10 lifestyle changes to lower risk of dementia and Alzheimer's. A little bit of forgetfulness with age is normal, but the kind of memory loss that some people face, especially in a condition called Alzheimer's disease, is quite horrific. Science is still struggling to come up with treatment for Alzheimer's. In the meantime, there are certain lifestyle changes that may help in reducing the risk of getting dementia. I'll give you 10 such ideas in this video. Point number 1. Engage in a regular aerobic exercise. It should raise your heart rate and increase your blood flow to the brain and body. Physical activity reduces risk of cognitive decline, in which one has trouble remembering, learning new things, focusing, or making day-to-day decisions. Point number 2. Learn or study something new. You can learn a new skill such as painting, pottery, cooking a new type of cuisine, etc. In fact, it is found that formal education, such as doing a course in a local community college, is even better because it pushes you harder to learn new things. These days, a lot of courses are available online on interesting subjects. Some are free and others need payment. Do search for something that you would like to learn. Point number 3. Challenge your brain through puzzles and games. That will keep your mind active. Learn to solve a Sudoku, a crossword, or a jigsaw puzzle. Play games such as chess or bridge, which make you think strategically. Games where you do not have to think may not help that much. For example, the card game called Solitaire may not stimulate your mind adequately. Now, one caution. Once you get good at some game, your brain stops challenging itself, as it may not need to learn some new skills. So once you master a game, maybe you should switch to another. Point number 4. Get involved in social events that keep you engaged purposefully. Find out activities that are meaningful to you. You may join a music group, spiritual group, social service group, such as one that helps pets, educates poor children, or plant trees, whatever. Point number 5. Stop smoking. Smoking increases the risk of brain decline. While the exact reason is not fully understood, nicotine is known to damage small blood vessels. If they rupture in your brain, that small region of brain goes into cognitive decline. Once you stop smoking in a short period of time, your risk of memory loss reduces so much that it becomes comparable to those who have never smoked. Now, isn't that a great news? Point number 6. Reduce obesity, high blood pressure, and diabetes. See, these are the risk factors for heart disease as well as stroke. And exactly the same factors affect your risk of dementia too. You may have heard of type 1 and type 2 diabetes. There is an interesting hypothesis that says that Alzheimer's disease is type 3 diabetes, or the diabetes of the brain. But more on that in some other video. Point number 7. Get adequate sleep. If you have problems such as insomnia or sleep apnea, which result in poor sleep, they may lead to memory loss and hampered thinking. Point number 8. An injury to the brain can increase the risk of dementia and cognitive decline. So protect against any possible brain injury. Always wear a seat belt even if you are in the rear seat of a car. Use helmet if you are playing any sort of contact sport which involves a possible fall, such as frisbee or cycling, or a head impact with the ball hitting the head, such as in soccer or cricket. Even if the game is played recreationally, always think through first as to how you can prevent a fall during any such activity. Point number 9. Eat a low-fat diet which is high in fruits and vegetables. Certain diets such as the Mediterranean diet or the MIND diet, which is a hybrid Mediterranean DASH diet, may help. Google for details on them. Increased intake of vegetables and fruits is known to help many health conditions, possibly because of the phytonutrients and antioxidants in them which protect against degenerative damage. Note that dementia is a form of brain degeneration. Point number 10. If you're facing anxiety, depression, or extreme stress, seek treatment for them. A history of depression is associated with increased risk of memory loss. So if you have symptoms of depression, anxiety, or any other mental health problem, getting treatment for them may just help you prevent Alzheimer's. Finally, keep an eye for the signs of memory loss and seek professional help if you notice them. Here are some more videos that may be interesting to you. Remember, ignorance is a bad idea when it comes to preventing dementia. Thank you.